PEDro user, Ruth, submitted this question to the You Ask PEDro Answers campaign. In musicians with musculoskeletal injuries, does trigger point therapy decrease the time to return to playing an instrument compared to rest and advice? This question contains all of the PEDro components. P for patient is musicians with musculoskeletal injuries. I for intervention is trigger point therapy. C for comparator is rest and advice. O for outcome is return to playing an instrument. Possible search terms for each PEDro component are musician asterisk, performer or instrument for the patient, trigger asterisk for the intervention, rest advice for the comparator, and return to play for the outcome. So which of these terms will uniquely and inevitably be associated with the articles that answer this question? A term for the patient is probably the best place to start, as we anticipate that there'll be very few trials, reviews and guidelines evaluating physiotherapy interventions for this patient group. If we think of more about the terms related to the patient, the word instrument can also be used in other contexts, including instrument-assisted mobilization and measurement instrument. This means it would not be the best alternative here. The term musician asterisk is helpful as it covers both musician and musicians. Let's enter this into the abstract and title field. If we run the search, we get 13 articles. None of the reviews or high-quality trials specifically evaluate trigger point therapy. You may be interested in reading an evaluation of a different treatment for musculoskeletal pain in musicians. For example, the randomized controlled trial entitled Effect of a Rehabilitation Program on Performance-Related Musculoskeletal Disorders in Student and Professional Orchestral Musicians. Let's go back to the question and think about the search terms to see if we can make them broader or use synonyms. It may be better to make the term for the patient broader and add a term for the intervention. To broaden the term for the patient, we could consider anyone with a musculoskeletal injury instead of musicians specifically. Use the back button on your browser or the Continue Searching Advanced hyperlink to return to the search page to edit the search terms. Delete musician asterisk from the abstract and title field. Select musculoskeletal in the subdiscipline drop-down list. Type trigger asterisk in the title only field. If we run the search, we get 205 articles. This means that our search terms are now too broad. Let's go back to the question again and think about how we can make the search terms more specific. Perhaps we could be more specific about the body part involved by focusing the search on the arm. Return to the search page to edit the search terms. Select upper arm, shoulder or shoulder girdle from the body part drop-down list. If we run the search, we get 80 articles. These include 4 systematic reviews and some high-quality trials that evaluate trigger point therapy. Perhaps the review entitled Effects of Dry Needling Trigger Point Therapy in the Shoulder Region on Patients with Upper Extremity Pain and Dysfunction is a good place to start. Being more specific with the terms used for the intervention can make the search more precise. For example, if you're interested in trigger point therapy applied using dry needling, you could select acupuncture in the therapy drop-down list. This reduces the search result to 26 articles. Alternatively, if you're interested in trigger point therapy applied using manual therapy, you could select stretching, mobilization, manipulation, massage in the therapy drop-down list. This reduces the search results to 42 articles. Remember, if your search returns too few relevant articles, you can make your search broader by removing or amending the search terms. If your search produces a large number of search results, you can make it more precise by adding extra search terms.